All right, what is heart failure? Heart failure is the inability of the heart to pump sufficient blood to meet the body's needs. Poor tissue perfusion. It's characterized by poor tissue perfusion due to a poor pump. If you didn't know, your heart's a pump. If it's pumping poorly or failing, that's heart failure. Heart failure is associated with myocardial disease, and so the reason that pump is not working is because it's diseased. Heart failure is a progressive condition, so it's not like you don't wake up, you can wake up and, be having a heart attack and immediately have an issue. But the long-term effects of that heart attack are what heart failure is. And so it's not an overnight thing, it's a progressive thing. Most common causes of heart failure are coronary artery disease or atherosclerosis and myocardial infarction. Causes of heart failure include ischemia, infarct, valve disorders or damage, cocaine, alcohol, hypertension. And so basically, here's what's happening. There's something that has gone wrong with your heart, whether it's a heart attack or some kind of disease or some kind of trauma. Something is happened to your heart, and it's decreased the cardiac output of your heart, it's decreased the systemic blood pressure of your heart, it's decreased the perfusion to your kidneys, and so your body's going to try and compensate for those things with the renin-angiotensin-aldosterone system, along with the baroreceptors in your system. So the baroreceptors in your system are going to say, oh, the blood pressure is low, let's go ahead and increase the blood pressure. Little does the heart know is it's kind of defeating itself. That vasoconstriction is going to increase the afterload, and your heart's already struggling enough. Like, it's like, oh, please just stop, don't. But it doesn't know. And so the vasoconstriction is not helping, but that's one of the things that your body will do to try and compensate, just increasing the strain. And then the renin-angiotensin-aldosterone system is going to increase the fluid. So now you're also drowning the heart, adding more fluid into the system for your heart to pump as a compensatory factor. But now it's making it worse, and so it's a progressive disease. There's two types of heart failure. There's right-sided heart failure and left-sided heart failure. Right-sided heart failure is going to look different because the fluid, if it's the right side of the heart that's failing, the fluid's going to be pumping to wherever the blood is coming from. And so if it's coming in the right side, it's coming in the right atrium. What's before the right atrium is going to be the superior and inferior vena cava. And so if you're going up, you're going to see jugular venous distension. So essentially the blood is backing up into your jugular veins, and you can actually see it in patients. Or if you look down, there's going to be peripheral edema, and so there's going to be foot swelling. Sometimes it's as bad as you'll see like patients with just like weepy, like almost just puffy. It's not sweat. It's not a sweaty foot. It's just like a weepy foot because there's so much fluid down in their dependent extremities. And so there's also weight gain, ascites, so third spacing. Once again, the fluid is backing up into their whole body, and their body doesn't have all that space for it, so third spacing is going to happen. Hepatomegaly, and then just overall peripheral congestion. So you will be edemic. Left-sided heart failure is a little bit different. So with the left side of the heart, you're going to sound wet because the fluid is backing up into your lungs, your pulmonary system. You go to check lung sounds, the fluid's backing up. It's going to sound like that person's, they have crackles. They're going to sound like just wet. You can actually, sometimes you can just hear them from across the room. You walk in and you're like, oh, that person has left-sided heart failure. You'll just walk in and be like, dude, it sounds like they're trying to, they were in a pool for an hour and a half, not that great a swimmer, and they're just like coughing up whatever. It's because there actually is fluid in their lungs. There's going to be an S3 gallop, dyspnea on exertion, because if there's fluid taking up the space of where there's gas exchange, they're going to be tired because they're not getting the proper gas exchange. There's going to be oliguria. Diagnostics include an EKG, and so that'll show more so like infarct and injury if there's something going on with your heart in the first place. A chest x-ray is going to be a little bit more indicative because it's imaging. BNP less than 100 is normal. Over 100 would be indicative of some kind of heart disease or stretching of the heart muscles. If it's severe, it can be severe all the way up to 900 or above would be indicative of severe heart failure. A Muga scan evaluates the pumping action. An echo will test the ejection fraction, and a normal ejection fraction is 55%. If it's less than 55%, that's not good. If it's 40% or lower, that's indicative of heart failure. There's also cardiac cath and then pressure monitoring catheters that can also check. So I'll be coming out with another video talking about nursing interventions and then pharmacology as well. So be on the lookout for that. But that pretty much is it for this video. So nurse peeps, hey, you guys do great on your next test. I wish you guys the best of luck. If you got any questions, feel free to put it in the comments below. Make sure you smash that subscribe button and then join the Nurse Sack fam. So we go.